don't they even they go sleepy? Yeah. Ja. Genau. Du willst gerne die Rücken oder? Ja.
So I think it's time. I think we can start now.
Yes.
So before I go in to talk about the ghost point today, I'm gonna show you one case. This is from Dr. Hu clinic. As you can see that the patient. So the chief complaint is the left hand weakness and abnormal crying and smiling for 1 year after the surgery. The surgery of right cerebral infarction for 1 year. And then after that, the patient had abnormal crying and smiling for 1 year. So if what kind of treatment you will use for this patient? If you meet some patient like this, like crying and smiling, so do you have an idea like how to treat it? So ghost point, yeah, that is we are going to talk about. But other methods, like how you usually treat this kind of like patient.
What the? They are very shy, you know.
Okay. So she can talk normally, and she would cry and smile without any reason, and she cannot stop like crying and smiling. So it's like kind of sometimes it's kind of crazy, and also influence her life and also influence the people surround her. So the point that we use ghost point. Yep, exactly. We use ghost point, and we regulate the spirit. We call regulate the spirit. So I will talk about it later, but I just want to show you that we have the ghost, like we have the method to treat this kind of patient, especially by ghost point, and also we regulate the spleen and stomach too. And this is one case that's very interesting. After second time of treatment, she got better. And then after third time of treatment, the smiling and crying, it disappeared. But she still had the lack energy of the leg and the hand, but smiling and crying, it disappeared. So as you can say, that ghost point is very effective. So I will tell you about how to choose the ghost point and how to choose the other points in treating like emotional and mental disorder later. This is just example. So good afternoon everyone, and my name is Claire. This is my Thai name, so I'm not from China, I'm from Thailand. And nice to meet you all. So today I represent Dr. Lingxiang, Professor Lingxiang, to present this lecture, because she's 74 years old now, and she might able to give a lecture, because now she have to take a rest after the long day of clinical practice. And I've been studying with Dr. Lingxiang for about don't care. So I've been studying with her for about 5 years, and when I have time, I have take it out the low quality. So I've been with her for many years. Started from when I was in first year. I went to her clinic for helping her without knowing anything, without knowing how to do a needle, without knowing how to pick out the needle. And then she is the first one that treat me how to do the acupuncture on the real patient. She gave me that opportunity to do the first needle on the real patient. And some of you might already been to her clinic before, yesterday and today, right? And she is very kind person. This is her picture. So here is Dr. Hu, and here is me. and she's very nice and very sometimes very funny person, very funny, and she willing to teach you. So if you go to her clinic and you have like question or you have something that don't want to ask her, just feel free to ask her. She is very nice. Before we going to talk about ghost point, which is the one that we will focus about, we're going to talk about emotional and mental disorder in Chinese medicine point of view first, because ghost point is the point that especially treating emotional and mental disorder. So reason why you have to know what exactly TCM think about emotional and mental disorder. And also clinical application, not only the ghost point itself, but also another point which is related and can treat some of the emotional and mental disorder too. So I hope that after the class, you guys can like use it in the real time, because this kind of method is very effective and very easy to do it, and very flexible. You can use it very flexible in a lot of diseases. And the last one, I'm gonna talk about clinical case. So we have to understand what is emotion. What exactly emotion means. Emotion, look at the Chinese character here, 情志. So there are two characters. First one, 情. So 情 is mean feeling, or 7 feeling, like joy, anger, grief, anxiety, fear, terror, contemplation. And 志 here means the external reaction of the spiritual and emotional changes of 5 organs, or 5 zang organs. So together, two words, they form 情志, or emotion. And these are how emotions related to 5 zang organs. You might already study before, right, about this. And another word is also important too, that is mind. Mind or spirit or conscious. 精神, 精神 in Chinese. So what is 精 means? You might have heard about 精 accents from kidney, and that is the meaning of 精 here. And 神 here means spirit. Means spirit. What is spirit? So spirit means spiritual and mental activity. Also is the general names of 5 shen. So shen here also included 5 spirits. And because jing and shen have the very close relationship together. Because jing is the basic material to forming shen. One of the basic material to forming shen. So without jing, shen cannot form. So lack of jing, also your shen can have like low quality of shen. So they usually put it together, called jing shen. So, there are many different understand about spirit in TCM, but one that very general is shen is general description of controller of human being vital activities. So it's the meaning of the controller of like your vital activities in the daytime or in your life. And also is a general name of external general performance. For example, your expression, your performance, your behavior, also related to the function of shen or spirit. And Chinese medicine had divided shen into 5 kinds. So also they have a different function, and will show the different activity too. So there are shen, hun, huo, yi, zhi, or mind, which is stored in heart, and enteral soul, which is stored in liver, and corporal soul, which is stored in lung, and intellect stores in spleen, and willpower stored in kidney. So they form spirit. So TCM divide them into 5 spirits here. And also knowing the physiology and knowing pathology, or like the normal and abnormal side of 5 spirits, also will help you with treating, and will help you with making diagnosis. So we look at each spirit. The first, the most important one, mind, or shen. Usually we'll translate like mind, conscious, and spirit. So because it's related to the heart, and the heart is like the kind of big boss of all the organs. So this one also have the meaning of enteral soul, corporal soul, ideation, and willpower together. So like it's kind of big boss of all the spirits. Look at the generalized meaning. Also means the external reactions of the whole body. For example, your image when the patient come to the clinic and you see her image, see her expression or complexion, like the face, the eyes, and also the sound or the response. So if the function of spirit or mind is normal, also that you can tell that the 5 zang organs will be normal too, because this is the big boss. That is a very easy way to think. But if go wrong, if the heart or the spirit go wrong, then patient may have like because the mind or spirit is responsible for consciousness, thinking, and affections, memory, and sleep. So if the patient had bad sleep or like blurry mind, or cannot be concentrate, that is the sign of abnormality of spirit and mind. It is too quick.
No.
So enteral soul, hun, which is related to liver. I can give you the PowerPoint later.
Great. Thank
Yeah.
you very much.
So hun or enteral soul responsible to conscious vision and unconscious dream. So conscious vision, especially in the daytime, what we see, what we feel, what we look at in the daytime. And then unconscious dream, like what we dream or what we dream when we sleeping. So in the ancient time, they explain the hun or ethereal soul as moonlight, which is the sunlight that reflected by the moon. So the moon itself is dark, but when the sunlight is reflected, so that can lead to forming of the moonlight. So in ancient time, they explain hun as a moonlight. And also in this concept, you can use to explain the relation between conscious vision in the daytime and unconscious dream in the nighttime. So making dream is totally normal, right? Everyone have like dream every night, sometimes good, sometimes bad. Like when you see something in the daytime, and then in the nighttime you will dream about it. Like you will, for example, you eating cake in the daytime, and then you dream about eating cake in the nighttime. So that can be the sunlight that reflect to the moon, and then you'll be able to dream at night. But how to determine which kind of dream is good or bad? Do you have any idea? Like how to determine like which kind of dream is good or bad for your body? Someone might say nightmare or good dream, or like dream about a beautiful girl and dream about angry like a crazy girl. So the easy way to like determine the good and bad dream, which will influence your life, that is whether it's influence your life or whether it's influence your energy or not. So if you dream about you swimming, or you dream about something happy, and then it will not influence your energy in your daytime. You feel feel normal after making dream. That is totally normal. But if you dream about dead people, about zombie just like go crazy around you, and then you just so afraid, so fear about that zombie, so that is the bad dream, because in the daytime you will remember about that, and then it's kind of influence your energy. You feel so tired. That is the bad dream. And because liver is opening at the eyes, so you can make a relationship between conscious vision and liver opening in the eye here, what you see in the daytime. And also based on the function of liver, that controlling thinking, and gallbladder controlling deciding. If the person has strong liver but lack of gallbladder function, patient might be able to think but cannot make a decision. But in opposite way, for some people that will make a decision very quickly without any thinking or without any consider. So that is also the sign to make a syndrome differentiation, and also will help you with like treatment and also how to use the points as well. So that's just for example. And also you might see sleepwalking and talking in one sleep. That is also the sign of separation of mind and enteral soul. So based on this concept, we also can use the point, which is from liver meridian, and also especially the ghost point, that from gallbladder meridian or liver meridian, by this concept. And corporal soul or lung, po. So this is responsible for instinctive response. So in here we have the moonlight, right? So what is the moon? Here, the po is the moon. So if we are the earth, if a person is the earth, so when we was born, the moon will come around us, will like travel around us, will come with us. And also po, like po, when we born, instinctive response will come with us. Like newborn infant cannot be able to think like us, like adult, right? But in newborn infant be able to feel and to move the body, and also to hear, to eat, and express the feeling. So that is instinctive response, which is related to po. And also based on this concept, based on this idea, we use this idea for treating pain syndrome and itching or some abnormal feeling. in the patient because lung is governed, it stores corporeal soul, which is responsible to instinctive response. And based on this idea, we used to treat pain syndrome, which is you will have the lecture about pain syndrome next week, and he will give you more information. But this is concept that how you can treat pain syndrome by regulate the lung. That is regulating qi flow of lung meridian can be able to treat pain syndrome. And because lung is governed the qi, right? So the qi of the whole body. So based on that idea too. But in Dr. Hu clinic, most of the time when she do some acupuncture on the point that from the lung meridians, she will use this concept to explain instinctive response. E, intellect, which is related to spleen. So do you have some problem with concentration or memory? Someone know, right? Because you have like strong spleen. But for some that have the problem with memory, like making memory, like remember thing. Also, it can tell that that patient has abnormal function of spleen, because intellect responsible for thinking, memory, concentrate, and planning. So if a person can be able to plan or manage things perfectly, like properly, so that means that person has a normal function of intellect. And also, but don't forget that overthinking also can harm the spleen, which will influence to intellect in the end too. So not too over. So we talk about like it's just a right level of thinking. But in opposite way, if a person cannot be able to plan or manage things, or sometimes too strict about manage things, like OCD patient, obsessive compulsive syndrome, people might be like everything want everything to be perfect, like too perfect. That is not normal too. That is just not in the right amount of intellect. And as you can see here, addicted to cigarette or alcohol. This is kind of the big problem too, like in not only in China. The people that addicted to cigarettes or alcohol, we also can use the idea of treating spleen in treating the people that addicted to something, because spleen is, as you can say, like it's responsible for memory and concentrate. So people, when they addicted to something, they concentrate, and then the memory, and also they thinking about it all the time. So based on this idea, you should consider about treating spleen for addicted person. I will tell you later like which kind of point that we can use for addicted. 2, willpower, the last one, which is related to kidney. So this one, 智, what 智 means in Chinese? So 智 means ambition. Like the person will finish the work after making decision right away. So when you think about doing something, when you make a decision, you just have to finish it right away. So if the person that have abnormal function of willpower, they will not be able to finish it after making decision. Maybe that person might be able to making decision but not be able to finish it, and will afraid of afraid of going to finish it, like, no, I'm not going to finish it, like think about that, like not confident enough. And also it's also related to abundance of or amount of kidney essence too. So in here also can tell if that person fear and not determined enough to finish thing. Is also related to kidney essence. And also for some people that procrastinated, like will not finish it right away, like procrastinated. Also, you can think about using the treating willpower to treat that kind of patient. So it's not only how 5 Zang organs related to 5 spirits, but also the location of a acupoint also have the very strong relation together. And you can say this is the first line of bladder meridian, and this is the second line of bladder meridian. So the the lung and the pore will be in the same level, and heart and shen, liver, hun, spleen, and yi, kidney and zhi. So knowing the Chinese name of the points also sometimes very interesting too. Like also will tell you some information. So we make a conclusion about 5 spirits. So emotional and mental changes will affect the heart first, because that I say that the heart is a big boss, which is also included the 5 spirits in the heart. But it's not only related to the heart itself, but also will related to other organs like especially in organs or zang organs like the spleen, liver, kidney, and lung. And all 5 in organs influences the emotional, mind, and spirit in different way. Like as I say, patient not determined enough, that also related to willpower, or the patient cannot be concentrate or thinking sometimes thinking too much or plan too much, also related to intellect, or have a pain problem or instinctive response, like have slow response about not sensitive enough to something that stimulate like the skin or body, might related to corporal soul, or ethereal soul, like making dream, sleeping, walking, talking in one stream, etc. Or the heart cannot sleep well, cannot concentrate, lack of consciousness. So it's influence the emotion and mind in different ways. And the complex of these 5 these 5 mental and spiritual phenomena represents the Chinese medicine view of body, mind, and spirit together. So we not put it apart. We put it together. We think about like holism idea. And 5 spirits together, they form spirit. Like this is the big spirit, so they form spirit. And the in organs are the house of Shen, the where that the Shen live. And the 5 in organs are the physiology basic of spirit. So the state of qi, the amount of qi, blood or nutrient or jing essence in each organ also will influence the mind or the spirit too. So emotional and mental diseases in TCM. So how the spiritual activity affect emotion and mind? So under normal circumstances, the spiritual activity will not lead to disease or disorder, but only under sudden, strong, and long-lasting stimulation will be able to cause the disorder of activity of qi, like abnormal of qi movement, and then in the end it will affect the dysfunction of zang and fu organs in the end. So under normal circumstances, it's not gonna lead the disease, but only sudden, strong, and long-lasting. So emotional and mental disorder in TCM included acute and chronic disease. For example, epilepsy, depression, which is very common in the clinic, insomnia, right? Forgetful, like easily to forget thing, and also mental disorder in Western medicine concept, autonomic nerve dysfunction, neurologic symptoms, etc., which has something to do with mental and emotional. So for example, like stress, depression, false perception, hallucination, insanity, coma, epilepsy, OCD, or addicted to something, also included in emotional and mental diseases in TCM. And because TCM takes syndrome differentiation very seriously, as you know,